Agenda setting in CBT. What is agenda setting? Kennerly and colleagues provide an apt overview of the purpose, nature, and structure of agenda setting in therapy. It is a foundational skill in CBT and an ongoing process session to session. Agenda setting is the process of planning and structuring the therapy session to ensure important topics are addressed within a limited time frame. The agenda is mutually set and agreed upon by the therapist and client early in the therapeutic relationship in order to promote engagement and keep discussions relevant. The therapist asks for input on the important items to include and provides an opportunity for the client to decide what is most relevant. The agenda usually includes an overview of the past week, a review of the previous session, an assessment of the current mood of the client, and review of any homework or practice assigned by the therapist, the current main topics of discussion in the session, assignment of new homework, and time for feedback. Some common challenges in agenda setting described by Kennerly and colleagues are setting a vague agenda, including too many items, not having genuine input from the client. These challenges will be discussed within the context of the agenda setting items as we go through them. Briefly discussing how the past week has gone provides the therapist with useful information surrounding the client's presenting issues to determine important topics and address them in therapy. In practice, this could be gained through direct inquiry about what has occurred during the week. Other times, it can take more effort to get to the specific information for this section of agenda setting as the clients discuss their mood and what has been helpful from previous sessions in managing their challenges. Using information gained about the past week to inform the agenda helps to avoid the challenge of vagueness by addressing specific ongoing issues rather than viewing the client's struggles broadly. Reviewing the previous session with the client gives each party the opportunity to address issues which arose, allowing the therapist to assess clients' retention of prior discussions and assessing whether feedback has been honest. This can take the form of discussing issues the client presented last session and inquiring if things had improved through the week through the use of homework. The therapist might also ask if anything in particular resonated with the client, or conversely, if the client was bothered by anything said in session. Early in the session, part of the agenda should be to assess the current mood of the client. Mood assessment can be done with standardized measures, rating scales, or informal discussion. The current mood may indicate areas to explore during the therapy session. Objective measures can be particularly helpful in disorders where the client might not easily recognize early improvement. Sometimes, when the client is sharing how their week has gone, the therapist can gather information about the current and overall mood of the client. If the client is already familiar with a standardized measure used previously, a therapist might let them know where their previous ratings were and simplify the question to a 1 to 10 self-report rating of the current mood to make this process more efficient. The review of assigned homework often overlaps with other items in the agenda, and some clients may adapt the language and prefer terms like practice, experiments, projects, or some other term with less negative connotations than homework. Thought records can assist the client through the week in identifying automatic thoughts and disrupting unhelpful reactions. Discussing the homework helps both the client and therapist to recognize what is working towards long-term recovery and what needs to be adjusted. The main topics of discussion are informed through the previous agenda items. The therapist can incorporate CBT skills in the process of addressing symptoms and life events discussed in the early stages of the session agenda. Occasionally, when asking clients to determine which is the most important topic to address, they will struggle to narrow things down. Suggesting a process of ranking the topics by which is having the most significant impact can support a decision. Other times, this section of agenda setting is informed through the client's description of their symptoms through the past week, and bringing in psychoeducation as well as interventions like behavioral activation could become relevant to the main topics of the session. Prioritizing and selecting a specific item to address resolves the second challenge of agenda setting. Working with the client to target a specific area in the session mitigates the risk of including too many items. The setting of homework is informed by the main topics of the session. This phase can be lengthy, so leaving time at the end of the session is important. The therapist can give advance notice in the early stages of the agenda setting process that homework will be assigned. Some clients recognize the benefit of assigned tasks and behavior activation and may ask if it will be included later in the session. The final item on the agenda is the opportunity for client feedback. The therapist can ask the client for their evaluation of how the session has gone and if there was anything said which could lead to a rupture in the therapeutic alliance. This is also an opportunity for the therapist to get a summary of the sessions from the client's perspective. Directly asking the client if anything bothered them in a previous session can be used to support the feedback process. Clients have the opportunity to answer honestly even if there were no issues. The challenge of gathering genuine input from the client is most relevant in this section. Having a good therapeutic alliance and encouraging feedback of all types can support the therapy and minimize the risk of this challenge impacting the quality of services provided. Now for an analysis of the demonstration videos provided for this assignment. In content, Dr. Todd Grand's demonstration addresses most of the 7 parts of the agenda setting. Feedback and approval was requested for the agenda setting process itself, but he didn't ask clients for feedback regarding the previous session. The video released by Qualia Counseling Services addressed each of the points except for a clear review of the homework. The client discussed applying the 5-factor model to the situations during the week, but there was no explicit discussion of the nature of any homework assigned. In terms of structure and style, Dr. Grand had a more conversational approach to agenda setting. Both he and the client were seated and conversing about the points. Conversely, Qualia Counseling Services took a more structured approach as the therapist stood and wrote on a whiteboard while working through the agenda setting process. Preference and personal alignment. The seated, conversational approach is preferable and aligns more with the style I would like to have as a therapist because as a client, I have preferred a more relational approach over a clinical one. While this may be a personal preference, I would like to be adaptable to the needs of clients I work with.